Good afternoon and welcome to the Eastside Recovery Hub's first program in our new Resilient Recovery webinar series hosted by One Redmond. Today is June 24th, 2020. My name is Christina Hudson and I am the Executive Director, and I will also be your moderator for the day. All our Eastside cities and chambers have partnered together to give the highest level of support to our local business community. And I want to thank all our Eastside and King County regional partners for the work that they are doing. A quick reminder to everyone that this is the last week to apply for the Payment Protection Program, or PPP. If you need assistance, please contact us immediately so we can have our advisors help you with your applications. You see the information here on the screen now, and we will also put contact info in the chat box so you can send us a note and we will connect you with an advisor. A reminder, this is a confidential service and it is at no cost to you. You can find lenders on the SBA website, and also there are online lenders as well, like Cabbage and Square, that can be used for the PPP applications. Another reminder that our past financial resources webinar recordings are still available on our website. Our PPP webinars actually walk you through the application step by step. And all these webinars are available on the Eastside Recovery Hub webinar page at eastsiderecoveryhub.com. So today's webinar is focused on Navigation Phase 2 Safe Start Guidelines, and we are particularly excited to be partnering with King County and all our regional chambers on the Personal Protection Equipment Small Business Safe Start Distribution Program. This includes cloth masks, disposable masks, and hand sanitizers. And I want to give a big thank you to Amazon and their treasure trucks for their partnership in assisting with the Safe Start kit pickups around our community. You will see here now on your screen the link where you can place your orders for pickup, and there will be locations around King County starting July 1. So before we begin, I want to cover a few housekeeping notes. If you need technical help during the webinar, please use the chat box. We have staff on hand and representatives from King County on hand to try and help with any questions and issues you may be experiencing. We also have links to pertinent documents in the chat box that you will be able to access. The tools we have here will also be available on our website, as well as being included in our follow-up emails. If you have questions for the speakers, please use the Q&A box, and we will do our very best to get as many questions answered either inside the Q&A box or during the Q&A live portion. This webinar is being recorded, and after the conclusion of the webinar, we will send out a link to the video content along with our slides and the answers to the Q&As that were posted. So we know that many business owners are seeking guidance, and we are hoping to help navigate you through all the information as we know it today. However, this is still a dynamic process, and as of right now, all the content you will hear on this webinar is accurate as of today. So let's get going with our program. To kick off, I would like to introduce Mayor Angela Burney with an update on the City of Redmond's new program available for restaurants. Mayor Burney, I turn it over to you.
Thank you, Christina. Thank you for that great introduction. Welcome, everybody. I hope you're all staying healthy in where we are today in Phase 2. But I want to share with you some of the updates we've done with the city and the work we're doing on helping businesses recover. We just approved a temporary outdoor dining permit. It went live on the city's COVID-19 business resource page on Monday morning. This permit makes available the opportunity for local restaurants to temporarily expand their seating outdoors in alignment with the governor's stay home, stay healthy orders. And this also allows, where available, businesses to apply for temporary sidewalk seating, partial repurposing of off-street adjacent private parking, and use of on-street downtown parking stalls. So if you're interested to apply for the permit, please visit the city's COVID-19 business resource page, and you can complete the permit application packet. And the city is arranged to facilitate an automatic grant reimbursement for the cost of the permit fee. Applicants will not need to pay any fees with their application submittal. Elise Keim is a staff point of contact should you have any questions, and that's also on the slide in front of you. And with that, I just want to say thank you for all of that you're doing, businesses, to keep going in this time. I'm really excited that our city was able to pivot quickly to in a government quickly sense and able to offer this opportunity for many of the businesses in Redmond. I hope it will add an opportunity for people to keep their businesses open, have a larger crowd come in a safe way, and keep your employees working. So thanks, Christina, for allowing me to share this program with all of you.
Absolutely. Thank you, Mayor Bernie. And for those who have questions on the new opportunities that the mayor was just speaking about, please post in the Q&A box and we will get those answered in our follow-up email after the webinar. So today we have Shannon Harris, King County's Business Task Force Lead, Community Mitigation and Recovery for COVID-19 Response. Also, we have Hugo Garcia, King County's Economic Development Program Manager and member of the Public Health Business Task Force, and Ann Shields, King County Public Health. And now I would like to go ahead and turn it over to Shannon Harris. Shannon?
Thank you, Christina. And a big thank you to One Redmond for hosting this. As mentioned, I'm Shannon Harris, and I'm one of the leads of the King County Small Business Task Force, which was started originally to share information about the coronavirus and COVID-19 within the business community back in March or late February. And as the crisis continued and we started to feel the economic impacts, we shifted our support to helping businesses navigate some of the financial impacts and trying to get information out about programs related to the SBA programs and other grant sources. And now that we're working on reopening, we're focusing on reopening safely and working on our dual purpose of helping businesses navigate reopening guidance as well as withstanding the financial challenges that they're facing. I appreciate Hugo Garcia being on the call with me as well as Ann Shields. Later in the meeting, we may be joined by Kate Becker, who is also on the Small Business Task Force, and she leads our efforts related to the creative economy. Next slide, please. So today we'll be covering COVID-19 and the impacts of racism. We are seeing disparate impacts of the epidemic in the United States and within King County by race, and we'll talk a little bit about that. We'll talk about Washington's Safe Start plan, preparing for reopening, operating within the guidance, and then we'll have time to take some of your questions. The Q&A feature will also be managed, and my colleague Hugo and Ann will be available in the Q&A to help answer questions as they come up. Next slide. So first we want to start by recognizing that King County, Public Health Seattle King County recognizes racism as a public health crisis, and that the COVID-19 epidemic has shown how apparent this is. Next slide. Racism and hate crimes, including physical and verbal attacks on Asian people and people of Asian descent, have increased with the spread of COVID-19. And in addition to this, people of Asian descent are being blamed for COVID-19 and discriminated against at times in their work and schools. We want to remind you that discrimination, harassment, racial profiling, violence, and other hate crimes is against the law and will not be tolerated, and encourage you to speak up if you hear, see, or read misinformation or harassing comments. Please gently correct any false information that is being spread and remind the speaker that prejudice language and actions don't make us safer, they make us less safe. So racism is also a public health crisis because our systemic racism in the US is creating health disparities among Black and Latinx people. Latinx, Native Hawaiian, and Black communities have significantly higher rates of COVID-19 cases and hospitalizations as compared to whites. The rates are also higher among American Indian and Alaska Natives. Black Americans have been dying of COVID-19 at about 2.4 times the rate of white Americans. This is a direct result of structural racism. The experience of racism and discrimination has impact in all areas of of our lives in housing, food, education, work, incarceration, healthcare, and opportunity. And this racism leads to worse underlying health conditions that make it more likely that a person will become severely ill during this pandemic. Thanks. So what is Public Health King County doing about this? So we've declared racism as a public health emergency, and we're committed to working in partnership with community organizations to disrupt and dismantle racism. So as business owners, you have a role to play in addressing this crisis. Just being aware that we are given messages throughout our lives that embed racist beliefs and behaviors, and we call it bias. So even when we assume that we're treating people equally, we may be implementing our policies and practices in a different way based on our biases. So being mindful of how we implement our policies, especially now in the time of COVID-19, is especially important because our unaddressed biases can have a direct impact on how we treat others. Next slide, please. So our Safe Start overview, I'm sure many of you are familiar about with Washington State's approach to COVID-19's reopening and recovery. And we just want to reemphasize that the reason that we're taking a phased approach and using our state's Safe Start process is so that we can keep tabs on how COVID-19 is moving through our community and ensure that we don't overrun our healthcare system by having too many cases at one time and not being able to address cases as they come in. So each county within Washington State is moving through the phases of the Safe Start program at their own pace, depending on how their data, how they're performing. Next slide, please. And actually, next slide, please. So many of you have seen that we've moved from phase 1. King County went through a modified phase 1 or phase 1.5. And as of last week on Friday, we moved into phase 2. So phase 2 means that restaurants and businesses, restaurants can open at 50% capacity and retail can operate at 30% capacity, as well as having a number of other businesses become operational. Next slide, please. So just a reminder about how we move from phase to phase. There are 5 factors that the state looks at when deciding whether or not a county is ready to move into another phase. They look at the overall COVID-19 disease activity, our testing capacity and availability, our ability to contact cases and do contact tracing, our ability to protect high-risk populations, and the overall healthcare system readiness. So the healthcare system readiness is one very important aspect of our ability to move forward through our phase, as well as the disease activity, again, so that we don't overwhelm our healthcare system with COVID cases. Next slide. So phase 2. This is an important step in our COVID-19 response and reflects all the sacrifice and hard work that our community has put into fighting this disease. The success of the guidance depends on business owners and community members embracing public health best practices and understanding that one size doesn't fit all. By opening our economy carefully and deliberately, we can make sure to stay healthy and continue down the path to full recovery. We definitely want to re-emphasize our good public health practices, which we'll talk about throughout this presentation, so that we can disrupt disease transmission in our communities and ensure that we have a safe and healthy workplace. Next slide, please. So this is a quick summary of what's open in phase 2. Not sure which businesses we have represented here, but we do have, there's fitness studios are able to operate with small class sizes, restaurants and taverns at less than 50% capacity, personal services, hair and nail salons, barbers, tattooists, professional services and office-based businesses are able to open, retail with some restrictions, and in-home domestic services as well as some of the businesses that were allowed to be open in phase 1. Yeah, next slide, please. So preparing for reopening, there's a lot to do to prepare, but a good preparation will allow your business to operate smoothly and hopefully not have any situation in which you might have your operations significantly disrupted. So today we'll go through these 7 items, creating a plan to protect your employees and customers, ensuring that your facility is safe, clean, and operational, getting and setting up any personal protective equipment, supplies, posters, or forms, reviewing and adjusting policies for leave, telework, and scheduling to fit with new legal and operational requirements, gathering materials that you will need to educate your employees in the language that they best understand, creating a plan for what your business will do if an employee becomes sick, and then continuing to operate within the health and safety guidelines. We won't be covering industry-specific guidance in this presentation, but if you do have questions, please post them in the Q&A and we can do our best to address industry-specific questions as they come up. Next slide. So your commitment to the health and safety of employees and customers, your role in our continued reopening is critically important. Next slide, please. The COVID-19 has already resulted in loss of life, health, and livelihood for thousands of people in our state. And the Safe Start plan is designed to help us ease back into our regular activities while maintaining our progress in slowing the spread. So just to reemphasize, you have a critical role in helping us maintain our progress. And we encourage you to follow the public health safety guidance even when it is difficult, and ensure that the practices are maintained in your business so that you can continue to help slow the spread. Next slide, please. So one requirement for reopening is that a site-specific COVID-19 supervisor should be designated by the employer at each job site to monitor the health of employees and enforce the COVID-19 job safety site plan. The state of Washington has provided a template. It's a phase 3 businesses template, but the information included in that can help you think through even what you might need to do for phase 2. There's one change for King County. In this business template, it says that you must report positive cases, a positive case in your work site to King County Public Health. That actually isn't a requirement within King County. But otherwise, the information in the state of Washington's phase 3 business template is good, and I would encourage you to look at that as you're preparing to reopen. Another option is through the Association of Washington Businesses. They have a safety plan template that you can customize, put your logo in, and walk through the different areas to consider as you plan for reopening. We've gotten a few FAQs about this. And Labor and Industries has confirmed that a site supervisor is needed for each work site or building. And we have also been asked what the site-specific supervisor needs to know. And so this individual should be familiar with the business's safety plan, any policies that you have put in place, and what to do if someone is sick. And they should also be empowered to enforce the safety plan and the practices in the workplace. Next slide. So the next 3 slides talk about the rights of employees. Employees are entitled to work in a healthy and safe environment. And so employers cannot retaliate against employees if they engage in activities that are protected under the WISH Act. So those activities include requesting or wearing personal protective equipment, which is required to be supplied by the employer, reporting a work-related injury or illness, including COVID-19, to an employer or to the Department of Occupational Safety and Health, or reporting an unsafe condition or requesting guidance from an employer or DOSH. So we want to emphasize this. We've been hearing from community and from employees that many employees are concerned about health and safety practices in their workplace, and they want to see their employer doing more to protect them from COVID-19 in the workplace. So just really want to encourage you to respect the rights of your employees in keeping that healthy and safe work site. The next slide, please. In addition, there are special protections for the rights of high-risk workers. So the governor has put these protections in place, and they include that an employee can be given the choice of an alternative work assignment, including telework, alternative or remote work locations if feasible, and social distancing measures. They may use any accrued leave or unemployment benefits if the alternative work assignment is not feasible and the employee is unable to safely work. And employers are prohibited from permanently replacing high-risk employees who are not working due to their high-risk status. Next slide, please. And finally, employees may refuse to work in an environment where the work site does not meet the COVID-19 safety guidelines. So employees are, or I suppose they would be ex-employees, but they can continue to collect unemployment benefits for good cause reasons. So if they're in a high-risk group or they're taking care of a household member who's in a high-risk group, if they need to stay home to take care of a young child because of the school or daycare closure, or if the work site, again, does not meet the COVID-19 safety guidelines. Next slide, please. Right, so now that you're aware of some of those employee rights, we'll talk about preparing your facility for reopening. Next slide. There's, let's see, 6 things on this list. There may be other considerations, but the ones that we are emphasizing today is just ensuring that you've worked with your building manager to make sure all utilities are working and operational. The second one, to flush the water system. So if your building wasn't occupied or had a significant reduction in use, your water system may need to be flushed in order to prevent Legionnaire's disease. So please do talk to a building owner or operator about your water system and ensure that it has been properly maintained before you resume going into the office. We've heard from many food-related facilities that there have been rodent or pest issues. So pest control was designated an essential service. And if you haven't had a pest control service out, you may want to do that prior to reopening. If your equipment's been shut off, be sure to monitor it, ensure that there's nothing that's changed with wiring or any other issues, and ensure that it will function properly. If you're in an industry where there is a limited reopening occupancy capacity, before you open, it would be good to calculate your new occupancy capacity within the guidelines. And then install any of the required hand washing stations, hand sanitizer dispensers, sneeze guards, floor markings, posters, etc. Next slide, please. One of the questions that we have gotten is, how do I calculate my building occupancy? So there are 3 places you may be able to go to find what your normal building occupancy is. It may be posted. You may be able to refer to recent permitting materials, or you can estimate based on the square footage. The Building Operators and Managers Association, if you go to their website, they have some instructions on how to calculate what your building occupancy would be. And so you would look at your normal occupancy and multiply that by the percentage, 15%, 30%, 50%, and then use that as your new occupancy allowance. That number may also be further modified in terms of if you could normally have 50 people within your space, and the new occupancy calculation shows that you can have 25 people in your space. That may be further reduced if, depending on your furniture or facility, you need to spread things out more to maintain the 6 foot distancing. So your new occupancy should also take into consideration the space that is needed to maintain 6-foot distancing. Next slide, please. Personal protective equipment. Next slide. So we've heard from a number of businesses that they're concerned about their ability to obtain the personal protective equipment and supplies. We're excited to be partnering with One Redmond and other chambers and community-based organizations to be supplying the masks and hand sanitizer to businesses. So definitely take advantage of that when those supplies become available. The other supplies that a business may need include dispensers for hand sanitizer, hand washing stations, gloves, sneeze guards, cleaners, floor markers, and posters. The Association of Washington Businesses has at their Rebound and Recovery site a PPE connector. And within that, you can enter the type of PPE that you're looking for, and they may be able to connect you to suppliers of the equipment that you need. Next slide, please. So as of June 26th, so this Friday, a new statewide mandate to wear masks will go into effect. And we've talked about that King County is helping to supply masks to businesses as well as to the general public. So those cloth face coverings will be required for anyone going out into public, but there are also industries that would require higher grade masks. Labor and Industries has provided a guide called Which Mask for Which Task, and this takes into consideration the hazards which an employee might face in the workplace, categorized from low, medium to high to very high. And depending on the risk, the employer or business will need to supply the appropriate mask, which may go beyond the cloth face covering. For example, within salons or barbershops, if someone is working on a client who has needed to remove their face covering for a beard trim or another service, the stylist may put on additional PPE in order to accommodate providing the service while the person that he or she is serving is not wearing a face covering. So the task does dictate the type of PPE that is required. Next slide, please. There are some minimal exceptions to the requirement to wear a mask. This information comes from Labor and Industries website. And I just wanted to ensure that people understand what some of the exceptions are to the face mask requirement so that no one gets into any hot water related to medical or disability claims. So if an employee does have a medical or disability issue that prevents them from using a mask, they should provide a medical professional's accommodation statement specifying that the facial covering or mask should not be worn due to their condition, and that should be provided to the employer. There may need to be adjustments made for people who are deaf or hard of hearing as well. Next slide, please. And then we also want to acknowledge that the face coverings directive does have a disparate impact on some communities. So I'm going to read this quote by Aaron Thomas of Columbus, Ohio. He says, "I know masks work and I trust the CDC's recommendation. What I do not trust is the innate biases and lack of critical thought about the implications of these decisions. I do not trust that I can walk into a grocery store with my face covered and not be disturbed. I do not trust that I will not be followed. I do not trust that I will be allowed to exist in my Black skin and be able to buy groceries or other necessities without confrontation and having to explain my intent and my presence. I do not trust that wearing a makeshift mask will allow me to make it back to my home." So this quote calls out the difference in treatment that Black and Brown communities have as they go about their lives, go into grocery stores, go into restaurants, and go into shops. And that by wearing a face mask, they may be treated differently. So as a business owner, again, be mindful of your biases. Ensure that you or your employees are not treating your customers or your colleagues any differently based on their race or ethnic background. Next slide, please. So the next thing to consider are your policies and whether those policies will support the behaviors that allow for a healthy and safe workplace. Next slide, please. So we encourage you to establish flexible leave and scheduling policies. We really want to encourage sick employees to stay home so that they don't put other employees or customers at risk. We want the policies to be communicated clearly to employees in a way that helps them understand that there is flexibility and that they will not be punished if they are sick and are unable to come into the workplace. And where possible, if there is flexibility that can improve social distancing in the workplace, such as staggered shifts or telecommuting some days, or anything that can help maintain distancing and overcrowding in the workplace will help you maintain the physical distancing required to prevent the spread of COVID-19 in your workplace. And so ensure that you have communicated your policies to your employees and that you've really reiterated your commitment to health and safety in the workplace. Next slide, please. Just as a reminder that there is a new leave requirement through the Families First Coronavirus Response Act, and that requires certain employers to provide employees with paid sick leave or expand family and medical leave for specified reasons. The provisions in this act will apply from the effective date through December 31st of 2020. The employers with fewer than 500 employees are required to follow this law, and employees who have been employed for at least 30 days are entitled to this leave. The next slide, please. Okay, one of the next requirements is that employers educate their employees in the language that they best understand. Next slide, please. So the topics that need to be covered in employee education include the signs, symptoms, and risk factors associated with COVID-19 illness, how to prevent the spread of coronavirus at work, including the steps that you've put in place to establish social distancing, frequent hand washing, and other precautions. And then the importance of hand washing and how to effectively wash hands so that, washing your hands for 20 seconds, happy birthday twice, those things that we heard a lot 2 months ago. And proper respiratory etiquette, including covering coughs and sneezes and not touching your eyes, nose, or mouth with unwashed hands or gloves. And then all of the business's policies and procedures. Next slide, please. There are a number of resources that will help you accomplish this requirement. King County has many posters and resources available that you can put up in your workplace as well as use as reference documents as you educate your employees. And we also have information in multiple languages. I see that the Department of Health has it in 26 languages. We have it in, I think, at least 26 languages as well. So depending on the styling that you prefer, you can look at King County's materials, you can look at the Department of Health's materials or the CDC resources, all of which are provided in multiple languages and hopefully match the language of the employees that you employ. So that is quite a library of resources, and I encourage you to take a look at that and select the resources that are most appropriate for your workforce. Next slide, please. So here's a sample of one of King County's posters. This one is intended to be employee facing, and it covers the symptoms of COVID-19. It encourages hand washing, keeping social distance, cleaning and sanitizing, and proper cough and sneeze hygiene, as well as the requirement that masks need to be worn. Next slide, please. We also have materials to post that are customer facing. That is a simplified version of that poster that makes sure that encourages customers and clients to stay home if they're feeling sick, to wear a face mask, and to keep at least 6 feet apart from others. Our posters have not been updated in the last 24 hours to reflect the new mandate for face masks. And so some of this language may be adjusted to be stronger to comply with the new state requirements. All right, next slide, please. So what happens if an employee is sick or is exposed? First, next slide, please. So first, one of the requirements is to screen employees daily. Some industries are required to use a thermometer or have an employee check their temperature, or you may go through a checklist of questions to ask the employee if they have any of the symptoms or a change in how they're feeling from one day to the next. One of the questions that we've received recently is whether the employer should keep a log of employees' temperatures. And while we do not recommend keeping a log of employee temperatures because that is medical information, a business may want to have a log that just says that the employee screening protocol was conducted, so that the temperature was checked or that the questions were asked, but not the specific outcome of an employee's temperature. If an employee does have a temperature of, I believe, a 100.4, they are considered to have a fever and should go home immediately. They should also go home immediately if they begin to feel any of the symptoms of COVID-19. If an employee is diagnosed with a positive test of COVID-19 and they were in the workplace within 7 days of that testing, then the workplace should be cleaned following the CDC guidelines. Next slide, please. If an employee has symptoms, we do have testing available and they should go and get tested. There are free clinics and you can find that information on the King County website. So again, unlike 6 weeks ago or so when testing was limited, now we do have testing capacity and we encourage anyone who has symptoms or were in close contact with someone who has COVID-19 to be tested right away. If someone needs to be tested and they don't have a provider who can do the test, please don't let that delay you. King County has a COVID-19 call center, which is open 7 days a week from 8 a.m. to 7 p.m. and that they can connect you with a resource in order to get connected with testing. Next slide, please. So if an employee is diagnosed, gets a positive test, then, or if anyone, but in this context, if an employee gets a positive test, then they should go into isolation. And so isolation is for individuals who are confirmed positive infected with the virus. They should stay home. They should, if they're in a shared housing, they should stay in their room and isolate as much as possible for up to 14 days. And we encourage them to do this so that we can halt further transmission. Quarantine is for individuals exposed to the virus, so who may have been in close contact with someone who is positive. And quarantining is something that you do even if you don't have symptoms or do not feel ill to ensure that you don't begin spreading the virus even if you are asymptomatic. So essentially when you're in quarantine, you know that you have been exposed and you're staying home in order to ensure that you don't become sick and spread the virus. So with this requirement that employees either isolate or quarantine if there are cases in the work site, that can be a major business disruption and we acknowledge that. However, it is critical that isolation and quarantine happens so that we can disrupt the transmission of the disease. If you're following some of the epidemiology, some of the talk is around an R factor. And if the R factor is over 1, that means that each person who gets sick infects kind of 1+ people with the virus. And so we want the R value to be less than 1, which means that each person who is sick infects less than 1 other person, which means that we'll have declining cases and be able to further reopen. One of the ways to do this is to go into isolation and quarantine as appropriate so that we can disrupt transmission of the disease. As a business owner, please do plan for high levels of absenteeism if you do have a case. So as you're doing your reopening planning, think about what you might be able to do to maintain operations if one or more of your employees need to stay at home for an extended period of time. Next slide, please. So with all of that, continuing our regular operations is really just reinforcing some of the messaging that you've heard likely over and over again at this point. Next slide, please. So the best ways to prevent COVID-19 in the workplace is to educate your workers about the symptoms and spread, maintain 6 feet of distancing, provide and use personal protective equipment, ensure hand washing is done and is adequate, that there's adequate facilities for hand washing, hand sanitizer for your employees, clean and sanitize regularly. So have that regular housekeeping schedule where you clean frequently touched surfaces, screen employees for symptoms, and keep your information up to date. Next slide, please. So reporting and assistance, we do have a few more resources to direct you to. Next slide. Labor and Industries has a consulting arm where you can make a request for if you have a particularly complex business operation and need assistance in how to apply reopening guidance, maintain that 6 foot distancing, or ensure if you have questions how to set up your workplace properly to align with guidance. So you can request a free consultation from Labor and Industries. If you do have active transmission in your workplace, we have a team at King County that does workplace investigations, and that is a non-punitive service. They are not looking at investigations in terms of looking at what's been done wrong, but rather they're looking with curiosity about what might be happening in the workplace that is allowing COVID-19 to spread. And they are very helpful, very compassionate people who can come to your work site, look at your facility, look at some of your practices. We had a webinar that they did a couple of weeks ago, and they talked through some of the case studies of what they've seen. And they've seen some issues related to break rooms, maybe not having social distancing maintained, or issues where employees are carpooling together. And because of that, maybe spreading the virus. So they kind of take a deep look at your operation and identify where some of the vulnerabilities might be, so that you can make changes and COVID from further disrupting your operations. And then finally, if there are non-medical questions that you have about COVID-19, including compliance and business-related issues, you can call our COVID-19 business and community information line Monday through Friday, 8:30 to 4:30 at 206-296-1608, as it is written on the slide, and ask any questions that you have. And we try to respond to any calls that come in, if not immediately, through information we have at our fingertips, then within 48 hours of the call being received. So that concludes the presentation. Next slide, please. Really appreciate you working through with us all of this information, and I haven't had insight into what's happening in Q&A or chat, but definitely look forward to hearing some of your questions and seeing what we can answer today and what we might need to get further clarification on in the future.
All right, thank you, Shannon. We are now, as you know, going to begin the Q&A portion of the program, and Hugo Garcia and Ann Shields will also be on the line to answer any questions along with Shannon. And I'll kick this one off. The mayor had announced some new opportunities for some restaurants. And so with new sidewalk expansions options for restaurants, how does that factor into calculating occupancy capacity?
So if Hugo might have more background on this, I know he's been working directly with businesses, but I believe the outside occupancy is still at 50%. So what your normal seating would be outside, you kind of spread things out so that people do maintain the 6-foot distance, and then I believe fill that at 50%. Hugo wants to correct me if I'm wrong.
Yeah, she's on the right track on that. And since the business owner would have to add the additional square footage of their outdoor space availability and look to make that meet the guidelines on the 50%. However, as mentioned during the presentation, if there's not enough room to have 6 feet distance between tables or seats, then it may be less than that 50%. Stick to having a maximum of having the 6-foot distance at all times, even on the outdoor space.
All right, perfect. And you know, we're seeing a lot of questions about the temperature taking, and they're wondering: are they required to take the temperatures at work, or are they? Could the staff do it at home? And what are the guidelines around there that we're seeing?
Yeah, so I believe in the guidelines, it gives the option of either taking the temperature at work or at home. So as long as the employee is able to verify that they do not have a temperature or a fever, they hopefully do have a temperature, but if they don't have a fever, that they won't report into work, that should fulfill the requirement. And if Anne has anything to add, I would welcome anything that she wants to add to that.
This is Ann. I would just add that you'll appoint a COVID supervisor for each of your work sites. So it'll really be working with your supervisor, if that's not you, and your staff to make sure you have a good solid plan in place for everyone to be monitoring, self-monitoring at home for symptoms, and reporting in, and feeling that they can, be candid if they are concerned about an exposure or any symptoms.
Okay, great. Oh, can you go?
I'll add just to add that point person to help kind of keep track of what those employees that check their own temperature are at home, to just let them know this is what it was today, so they have a plan in place for being able to keep track of that.
Super, super. There's another question on training and the requirement around there of training your employees. Can emailing documents to help inform your employees about what is going to be expected of them, or are there specific guidelines around training that you can share?
Yeah, so with the governor's requirement that employees be trained in the language that they best understand, the intention is that there is a dialogue and information is clearly presented to employees to ensure that there is comprehension of what the expectations are, what the needed information is about COVID symptoms, prevention, and what the organizations or businesses practices are. If that information is emailed, the employer might want to find a kind of a verification check, or have that site supervisor put in place a plan to be able to just check in with employees to ensure that that information is received and that it's been comprehended by the employee through some conversation. Even though the governor has said, post posters up on the wall, that is something to do to keep the information visible and available. But I think in order to be most effective, the employer should, or the site supervisor should be prepared to have conversation about those requirements, maybe at staff meetings, reiterate any messaging about, hand washing, safety, use and appropriate use of personal protective equipment, and make this a topic that is comfortable to discuss in the workplace. So rather than thinking, what is the easiest way I can check the box and fulfill that requirement, consider how harmful it can be if you have an outbreak in your workplace, and think about, how you would fulfill that requirement in a way that helps your employees to really understand the information and be actively involved in helping prevent transmission in the workplace. And
Right.
I again welcome my colleagues to weigh in as well.
All right. It's all right. So I'm going to go ahead and, in case anybody else, give a couple seconds. All right. I'll go ahead and move on to the next question. This question was, how are the phase requirements being monitored? As a business, can they expect inspectors from the state or the county, and are there associated fines?
So currently monitoring is happening on a complaint basis. So if a employee or a customer logs a complaint with the state, that is what triggers a kind of a compliance follow-up. There are fines that can be, what is the word? Not administered, but given, I'll just say given, by Labor and Industries for a business that isn't complying. Depending on the industry, this is also regulated by the Department of Health. So if you have a certification or license through the Department of Health, they may also get involved if the business is not complying with the guidance. But again, right now that is happening by complaint rather than having a kind of active enforcement or inspectors coming out to inspect the business.
Super, thank you. Oh, go ahead. I think someone was going to answer.
Just related to that question, I see several chats about requiring inspection before you reopen. And no, not required before you open. I think the slide entitled Preparing for Reopening, it gives you 7 points there. It's almost like a checklist for everything you need to do to be able to operate safely and get your doors open for business again. But you certainly don't have to wait around for a site inspection to do so, as long as you've got a good, safe plan in place.
Yeah, thanks, Anne, for that. Having a written plan is, writing down your plan, communicating that to your employees, and having that on hand so that if there is a situation where, if, heaven forbid, a complaint is logged against you, or if you have a workplace outbreak, there may be a desire to look at your plan and your protocols. So having something documented that shows what you've done and what your procedures are will be very helpful.
And we have some questions on indoor fitness activities for the phase 2 guidelines, one-on-one training, yoga classes with 5 participants or less. Are they required a mask? Sarah says the new mandate is slightly unclear about fitness activities.
That is a good point. In general, when someone is engaging in fitness activities, a mask is not recommended. And so that is something that we can kind of take for further clarification. And Anne, if you want to add anything.
I had also said that is a point for clarification with the state.
Yeah.
And also take into consideration your participants. Obviously, there's some fitness activities where droplets are going to be people breathe hard. Droplets in the air are the way this virus spreads predominantly. So some groups may not be comfortable at just 6 feet apart without a mask on. In some communities, people do mask up in, say, New York City when they run because they're in close quarters. So also take into consideration getting into the building, hallways, elevators. So people probably want to have a mask at hand, even if they're not using it during their actual exercise.
Thank you for that. Our next question is about the high-risk workers, and I know that encompasses a lot of different people. Maria Graves asks, in our case, there is someone over 65. My question is, do I have an obligation to proactively seek them out to discuss their options, or do I just respond if they bring it up?
The communication about high-risk employees should go to all employees. There is a risk of singling someone out based on age or perception of health status or disability. So if a general information is provided to all employees, where the information about the rights of high-risk employees is given to everybody, then that allows the employee to reach out to you if they need an accommodation.
Super, super. And I think I have another kind of industry specific question, but it is about, even though if you take temperatures of your employees, if an employee comes down with COVID and their example is a wedding caterer, and if an employee gets sick the day before the wedding, does that shut down the whole business? And can they not help the wedding and break their contract? That might be a complicated one.
Yeah, that one is
yeah, that is a really tough question, and a very tough question to answer. I mean, one of the things it really does, it just reaffirms the importance of your COVID supervisor having a good working relationship with your staff in such a way that people are feel confident that they can bring concerns about a possible exposure or a possible symptom up as soon as possible. But I'm not really prepared to comment on what that means for an event the next day. Other thoughts on that?
Well, I hope this isn't a real life situation that we've just been presented. The business owner, I hope that hasn't just happened to someone, because that's incredibly stressful. What I would also say is just thinking that this is something that they're anticipating happening, and hopefully isn't something that is happening currently, is, in your contingency planning, and as you think through your continuity planning, those kinds of questions and hypotheticals. Well, what if this happens, or what if that happens? Maybe think through that in your safety and your reopening plan, and see if there's a way then to keep employees separated by shift so that you can minimize exposure between workers, so that you may have kind of a second string of workers if at all possible. I realize for some very small businesses that may be not feasible. But I would just ask that, as you're thinking about different contingencies that might happen, that you use that as kind of a spark for creativity and thinking about, well, how would I handle it if this happens? So that you can continue to operate as a business and continue to provide services safely.
Super. I think we have another question on when do we expect to move to phase 3? Any thoughts on that?
If any of my teammates want to weigh in, but I would say we don't have a ball, and unfortunately our cases, I believe last week we had an uptick in cases, and so just it all depends so much on the disease activity and what we're seeing in the community. And so there is the 3-week requirement at each phase. We stay in each phase for at least 3 weeks. But then there's the huge dependency on what's happening with the disease and whether we're seeing our numbers going in the right direction. So there's a big only if to that question.
Yeah, I'll second what my colleague Shannon mentioned. There is no definitive timeline on it. There's a lot of variables in charge. It's a minimum of 3 weeks, and hopefully as we implement the mask as a more mandatory requirement, it helps to mitigate the spread, and that will in turn mean that we can move to a future phase faster.
Well, I want to move to PPE as well. I know there was some questions about the PPE link, and yes, we will be sending it out, and please share to other small businesses. We are very excited about our county's businesses accessing PPE through the chambers in King County. How do residents get the protection equipment?
So there's a few places where it'll be distributed. So we're partnering with cities to have it distributed at city halls where city halls are open. We're also partnering with libraries to make the PPE available for pickup at libraries as well. And then a number of community-based organizations are partnering with us to help distribute masks. So I would say for most people, the library system or their city hall would be the best places to look for masks and hand sanitizer when that becomes available. And we will definitely want to share additional information as final logistics on how that will be distributed are finalized.
Super. And Anne, I think this question is for you. It says, can you please review when a COVID employee could be allowed to go back to work? Are businesses required to get a physician's clearance before they can come back to work?
No, you're not required. To get a physician's check-in or approval to return to work. You are to wait at least 7 days after your symptoms have gone away. And I would also just add that this is a guideline that has changed several times. So it's always worth checking on the Department of Health or CDC website as we learn more about what is the actual infectious period. So it's gotten shorter, not longer, which is, I guess, good news for keeping people working.
Super, super, thank you. I think we've gone through a lot of our questions. I'm going to give a couple of minutes in case people have some additional questions. All right. Oh, here's a question. Which is the best website washing? What is the best website for washing your or cleaning your facilities? Is it the CDC website?
Yes.
Yes.
Okay.
Okay, and go on.
No, we were saying the same thing. CDC provides great guidelines on that. And so we don't have to reinvent that wheel here in Washington or King County. Just use the CDC guidance.
All right, super. And I believe that Kate Becker, King County's creative industry manager, has just joined us as well. Kate, did you have any feedback for us?
Hi, thanks everyone. Sorry, I had double conflict with this and had to present elsewhere, but happy to be here with you all. I caught the end of the presentation and just want to let you know that if you are working in the creative sector and you have questions, please don't hesitate to reach out to me. My contact info is in the slide deck that Shannon presented with.
Super. Well, I think we've answered almost all of the questions that we've had here. We will provide the answers to the questions that have listed in our Q&A box along with the recording of the webinar as well. I know there was some requests about getting all the links that were posted in the chat, and we'll make sure to send those links and resources with you when we send the link to the recording. So I want to thank all of our speakers today for giving us your time and expertise today. We very much appreciate it. I want to thank you again to all our Eastside and King County regional partners for the work that they are all doing to support the business community during this pandemic. Thank you to all of you for participating. Again, we will be sending up a follow-up email with the links to the recording and the links to the resources that were referenced. For key resources, weekly webinars, and grant opportunities, please go to www.eastsiderecoveryhub.com. And one last reminder, put in your request for that PPE so we can get that to you as soon as possible. Thank you again, and please stay safe and healthy.
Thank you for your time.